I'm Dr. John Kingdom, staff specialist at Mount Sinai Hospital. I've been here since 1998, so I work in the area of high-risk pregnancy, and since I came here I've established the Placenta Clinic as my specialty area within maternal fetal medicine or high-risk pregnancy. What the Placenta Clinic does is it does two things. It assesses people during their pregnancy who have problems that could result in early birth of the baby due to the placenta not working well. So that could be expressed in the mom, for example high blood pressure, or the baby not moving or not growing very well. We also see people who've had difficult pregnancies that have not ended well, particularly in other hospitals. So we're asked for advice as to whether it was a placental problem or not. And then we have to then counsel people and explain to them how we could establish whether placental function was good or bad, how they could optimize their own health to prepare for pregnancy, and then build relationships with them to give them the confidence to try again when things have been difficult or bad in a previous pregnancy. I think there's something for everybody in the Placenta Clinic if they're pregnant. We can reassemble the pieces of the jigsaw of what had gone wrong before. We can give a clear plan as to the placental function in this pregnancy. For many people who come thinking they're high risk, they're not. So for example, a woman who was 38, had IVF and was diabetic might well think she had a high-risk pregnancy. But we could show that woman that she had normal blood tests at week 12 and 16, that she had a long, thin placenta, normal blood flow, that based on our research in several hundred patients like her, we know that she's highly likely to do very well and very unlikely to lose that baby. So to receive that information by week 20, we hope could be very reassuring. We don't want to assume that that is reassuring, and we have a research program with our Department of Psychiatry at Mount Sinai Hospital looking at whether or not people can be objectively reassured and their anxiety levels may reduce as a result of going through this kind of program. And so that's again in its early phases, but we think that the whole patient's important at Mount Sinai Hospital, and therefore we believe their emotional health is just as important as their physical health. In an average year, the clinic will assess between 200 to 300 people. The clinic isn't exclusive within our division, so all colleagues are seeing people with placental problems because they're actually very common problems. So on a number basis, placental problems are a much more common cause of premature birth. So research at the Placenta Clinic is really quite central to many activities in the hospital. So first of all, we're involved in clinical research to try and improve pregnancy outcomes. But at the point of delivery, the placenta comes out obviously after the baby, and is a very powerful way in which we can understand what went wrong. So that involves molecular biology and pathology studies, which links the clinic to the senior investigators at the Samuel Lunenfeld Research Institute. So we've established a biobank, so with patients' written permission, patients are very excited to allow us to sample their placentas and study the molecular signals. We have clinical research in the unit, so we're asking questions about how we can more accurately identify people at risk of placental problems, and just as importantly, how we can accurately reassure people who think they've got problems that they actually will do well. And it's really exciting to be able to tell people in the middle of their pregnancy that, you know what, you will succeed, this will work where it hasn't worked before. That's very nice. And for more people than not, we'll have that conversation. The Samuel Lunenfeld Research Institute is a world leader in the area of development, including placental development, that we can really synergize between this exciting clinic and some of the world's most experienced investigators in molecular placental development.